Hello, everybody. Welcome to the Health Babes podcast. I am your host, Dr. Krystal Hohn. And today I'm going to be answering some of the questions that we get from question boxes on Instagram. Sometimes it's really hard to answer questions on Instagram and in these different places um, because there's so much more to say and it's easier to talk about it, right? And what better way or platform than a podcast to get into detail with some of this stuff. So, some of the questions recently that I've been getting a lot of is, especially with women being in perimenopause, going into menopause, what are some of the best things I can do to help and support my body as I transition in this very delicate time? Because you may notice, because one thing that I often hear is, gosh, I cannot seem to lose a little bit that stubborn weight, or I'm getting more belly fat as I transition in these years, or my goodness, the things I used to do just simply aren't working. And you guys, this is so common when it comes to these different transitions in from perimenopause to menopause. Very, very common because that communication in our brain, right? From the pituitary, hypothalamus, the pituitary to our body, it goes a little bit haywire. Okay, when it comes to hormones and when we're having these big shifts in hormones as estrogen decreases, as ovulation starts to get sporadic, we start to see cortisol become imbalanced, especially from chronic stress and lack of sleep. These times in our lives, like in our 40s, even mid 30s, are some of the most sensitive times. So everything is just a little bit heightened, and our bodies just aren't as resilient, right, as they were when we are back in our 20s or even teens, right? Now, not to say that you can't build resiliency or you can't help, your body in these times and flourish and kind of skate right by. You absolutely can, right? But it's common to see the body go a little bit haywire when we are going through these transitions. It can be very, very hard. And things that will make our hormones and these symptoms worse or more exacerbated, or you may find that you're gaining weight, you're more tired, you're not as um you don't feel as vibrant as you did. Your skin starts to change. You're not as resilient to stress. There's a lot of why that happens, physically and chemically in our body with the changes in hormones, but also too the things that happen in our life at the time, like stress, right? Some of us, we're raising kids and we are working full time and we have so much on our plate, especially in our 30s and our 40s. Those are the building years of life, right? So we have a lot coming at us. And so, on top of the shifts that happen naturally in our cycles, right? And things like that, and in our brain and the changes that just happen gradually as we get older, we're all going to go through it. These stressful events and the things that we go through can make us feel the effects of that can be heightened. And so you may notice that you are sleeping less. You may notice that you're gaining more weight. You may notice that you're a little bit more irritable. You have weight loss resistance, things like that, right? And you just may not feel like yourself. And so, some of the things that I do want to talk about when it comes to this loaded question, and let's just pick a couple that you can do to really support this phase in your life, is really managing your blood sugar. So blood sugar balancing is really important as you're transitioning from perimenopause to menopause, because as we start to transition a little bit more into these next phases in life, we can become a little bit more insulin resistant, especially as we have more stress in our life and we have different cortisol imbalances. It's all tied together, guys. So making sure that you are eating enough is so important when it comes to hormones. This is, I hear so often, I can't lose weight. I'm not, I'm holding on to things that I necessarily never held on to before, like in my 20s and my teens and things like that. And, I could just maybe watch my carbs a little bit and things would fall off. Or, guys, it's just not the same as our body is shifting because it looks at anything drastic as your body's trying to protect you. It's a protective mechanism as the body is going through these hormonal shifts. So it wants the body to feel as safe as possible before it's ever going to, allow you to maybe shed some of those stubborn pounds that aren't as easy to come off. So weight gain is a big one that I see. And I even noticed some changes in myself as I went through a really stressful, just this past year, not this past year, but the year before that, I had a lot on my plate, still trying to be mom at the same time, a good wife. My husband has a business, podcast, book, programs, traveling, all these things, right? I really noticed it took a toll and I was starting to gain weight, even though I was eating the same and still active and doing all the right things. But that stress was really dysregulating my nervous system and I was holding on to things. So even though I was eating the right things, you know, you can start to see the stalls when it comes to that. So weight gain, stubborn weight gain is a big, big symptom. And one thing that you really do want to do is regulate that blood sugar. And it doesn't happen overnight, you guys. You got to make the body feel as safe as possible. Like I started noticing some big shifts in myself just this past couple months with me sticking to hormone regulation through blood sugar regulation, meaning eating consistently, making sure I'm getting the right amount of protein right in and being more intentional with the foods that I'm eating, meaning making sure I'm eating enough, making my body feel as safe as possible. So you know how it is when you get really busy during the day and you're on the go and you'll just grab something quick. That's not gonna suffice when your body is feeling unsafe and you're wanting to maybe trim down a little bit. The reason why I'm even talking about this, I don't even really like to focus on weight loss, but it's such a big thing that I see for in that perimenopause to menopause is women and men. I mean, I know we're not talking specifically about men right now, but you can start to see in these stressful years issues with that, right? And so making the body feel as safe as possible, having a really good breakfast in the morning, getting in at least 30 to 40 grams of protein. I like to focus on getting at least over 100 grams of protein a day. If you're intentional about that, you're going to notice long term your energy is going to get better. You're going to be sleeping better. Making sure your meals are big enough, right? Not just having protein, but where's your fiber? Where's your color with really good fruits and vegetables and healthy fats? So that's a big one, blood sugar regulation and making sure that you are taking care of your body and fueling your body. You cannot you can't make the body feel unsafe and do anything crazy restrictive because it's not going to work. And long term, especially in these sensitive years, it's going to cause more harm than good. And I've even saw like really big restriction, especially with women in these years, cause weight gain. So you want to make the body feel safe, feed it fuel, okay? Regulate that blood sugar. Next thing too with this is um, regulating your nervous system. And, Beck and I talk a lot about the Gupta program, Lindsay Mitchell's the Vital Side program. That's great, but there's a lot too, you guys, that you can do at home. Like the Aura app has really good mindfulness meditations that you can get into, getting outside, taking care of the circadian rhythm, balancing our cortisol throughout the day. being more intentional with things that help the parasympathetic nervous system is essential when it comes to taking care of your hormones, especially in these sensitive years. So, really doing things to get us out of that fight or flight, because again, you guys, our bodies, they're resilient, but they're going to look at you and go, okay, I'm screaming here and you're putting a lot on me, and you want so and so to happen, right? You want to look the best, you want to feel the best, you want to sleep the best, you want to have energy. Well, when you just take from the body and you don't give it what it needs, you're going to have issues and you're going to start to get symptoms and things are going to fall short. Okay. So, limbic system work, whether you're working on the vagus nerve, meditation, going for long walks, getting full spectrum light, getting out and finding joy, spending time with your people, your family, all of these things are so very, very important when it comes to hormonal balance, especially in these sensitive years. Okay, so limbic work. I also find that when, especially with cycling women in these sensitive years, when we are overly stressed, we tend to get hyperfixated in the doom and gloom of our day, and we tend to become more recluse and not want to do things because we're exhausted, right? That's a natural mechanism that happens when you don't feel good and you almost feel a little bit down, depressed, whatever it may be. You don't want to go and be social, but sometimes you really have to step out of the box and surround yourself with people that bring you joy and laugh, because those really good neurotransmitters, you guys, are so important for hormones long term. And that was something that I found, even me personally, I had a little bit of struggle with that because I was so busy. Any extra minute that I got, I just wanted to go lay on the couch. I was burning the candle at both ends, and I knew I had to make some changes. And when I did, that's when I started to feel more like myself. And guys, it's not easy changes. It's not like, to say, I've always thought that my superpower was I can do a million things, I can do it all, I can handle it all. And I paid for it. I paid for it. I just simply, yes, I'm a very good, not micromanaging, but I can do a lot of things at once, right? I'm very, very good at managing my time, having a schedule. I can do a lot, I can get a lot done, but it also was taking away from a lot of me, right? I was feeling the effects of that, and I really needed to make some changes in my life, in my schedule, for my health. And finding joy and being with people that I love was a big part of that. So I'm trying to make more efforts with that, because when you get together with your girlfriends, your family, your guy friends, whatever, you always come back feeling good. It's like the biggest rush, and you feel so happy, and you're like, oh my gosh, life is good. You need more of that, right? And it could just be like a simple coffee date with a friend, or when you start thinking about a loved one, just call them, connect with them. It's such an important part of vitality with people, social connection. It's a big, big thing. And social media has given us a big disservice, you guys, because Instagram and TikTok and all these things, it can make you feel like you're keeping up with everybody, but you're not. You're just getting a peek in their life. You need to be with them in person, talk with them on the phone, and get that connection, and to really feel the effects of that. I feel human connection is such a big part of health, and we need to be prioritizing that. I know it's not always easy. I know we get busy, especially with kids. I mean, I am guilty with that. My daughter's basketball schedule is insane, and my son's about to start soccer, and me and my husband want to start our like date nights again. Usually we do like coffee dates and things that are easy to implement even at home so we don't have to leave. But it's really good to get dressed up, to feel good and go out with your husband and to feel human, right? So try to really work on that if you find that bringing more of that inner joy is really, really important when it comes to supporting our hormones. So I get that question as a lot is how do I help balance hormones in these really sensitive years? And regulating blood sugar, eating enough is really important. Working on the limbic system and finding joy. These are some simple things, not easy. So the simple things that are free, right? I find are the hardest to start implementing, right? Um, it's not like a strict program that you got to follow. You have to be your own motivator, right? You have to be your own motivator. You have to be the person to keep yourself accountable with these simple things. But if you do them consistently, you will feel better and you will start to see a big, big difference when it comes to how you feel. And even just with as you check on your hormones, you're going to start to see changes in your numbers and your levels and things like that. Because I've seen it time and time again with working with hundreds of patients throughout the years. Okay, so let's talk about some other questions that I get too. So I want to answer some questions too that we get even on some of our, not just question boxes, but through Instagram. Like if you guys make a comment on something, I want to answer everybody, but it's really hard when I feel like they're long-winded answers, right? So, okay. The other day we did a podcast and we talked about some of our favorite things that we really loved. And beautiful, wonderful, full Grace. Yeah, beautiful, wonderful Grace is what her name is. I love that Instagram handle, by the way. What is the best rebounder to buy? So, being that I just am a little bit new to rebounding, um, I've I've always loved the idea of rebounding. I'm like, oh, that's great. Just jump and really get things moving. It supports your lymphatic system. There's so many things that it helps you guys. But I never really got into the different brands and such. But there's some rebounders that are really high price point, and then there's some knockoff rebounders. Okay. So the one that I got for my daughter to practice her shots, getting more bounce in her shots and stuff for basketball. We were working with a trainer. And so it's just a cheapo, I think it was like either $50 to $60 on Amazon. My sister-in-law, I started getting her rebounding as we started, just working in things on her health and implementing some new things. I really wanted her to get some rebounding in. So I had her start that. And she ended up getting the Bellicon. Um, and it was $99 on Amazon. There's some that are like 400. You guys, I got on that $99 Bellicon on Amazon. It felt night and day difference. And this was after I talked about it on the last podcast where I was just like, I'm sure everyone is great. They're pretty all similar. No, guys, they're not. So the cheapo one that I got that was probably around 50, I don't remember. It could have been even 40. I just don't remember how much I spent on it. But the Bellicon, $99. It's black and green. I can link it on Amazon. That felt so good on my joints. You get really good bounce. I definitely am purchasing that one instead. So if you're new to rebounding, especially if you have sore joints, sore knees, anything like that, if you need something more gentle, it's a great way for you to get started, and it's not expensive. If you want to incorporate rebounding in your day-to-day, I cannot rave enough about it. And I'm only doing 10 minutes a day. You can do longer than that, but I do a 10-minute hit on the rebounder, which is a perfect amount of hit for me because I feel like I really break a sweat. It's easy on my joints, and I really do feel like things are getting tighter and I feel really good. I'm sweating. I just less cellulite. Guys, it's really good. And you're not going to get, you know, I don't want anybody coming at me with, oh, that's not going to reduce cellulite. There's nothing better for cellulite than eating clean, getting in your protein, and lifting heavy. You will never see better results for that. That is the best thing you can do for cellulite. But I have noticed, because I used to be a really big runner, and when I ran, I noticed it helped. I felt tighter on top of doing that with weightlifting. Well, I didn't really like how running started to feel in my joints. I turned 40 this year, as we all kind of go over the hill. And I wanted something more gentle, but still effective. And the rebounder was fantastic. So I've been doing it for 10 minutes every day with my weight routine. I switch up my weight routine between upper, lower, or I'll do both. And I'm still, I work a lot with the Mind Pump workouts. And then Kitty Bloomfield too. I really like her at home workouts too, which are really great. And we just recorded that episode. So it's a couple episodes back where we talk about a lot of our favorite things. And I have a lot of those links in there if you missed that episode. So the Bellicon, it's BCAN on Amazon. That is my favorite one. Okay. All right. I have severe muscle pain, and I don't know if I'm dealing with MCAS or just pain from long COVID, which we can start to see this. And she's wondering, this is Ashakan Carmen. She's wondering if rebounding would be good for her. So Beck and I touched on this a little bit with workouts. You really do, if you're someone who is struggling with long COVID or mast cell activation syndrome, and you find that you have a little bit of exercise, intolerance where you can't do much without it making you feel really bad, or if there's a certain workout or workout plan that really hurts your muscles, makes you feel worse, it's not for you. And when you're getting started with something, you have to do what makes your body feel good. So you may feel like, just getting on the rebounder and doing a light jump feels good. You may not be able to jump. You may have to go for light walks. You may have to start with stretching, working with very light weights, right? You have to listen to your body. But the one thing that I always say is do a little bit every day, whether it's rebounding, whether it's walking. Don't ever do something that causes you pain or makes you feel bad, right? You don't want to do that. You want to listen to your body. But as you're working on calming those mast cells and doing the things that you need to be doing to calm the nervous system and to get your body to feel safe again, that's when you're going to be able to push yourself a little bit more and implement more of these things, right? Because it's just something that we often see with people in their beginning journey. I had a patient, it always sticks out to me, who was bedridden. When she first started working with me, she was bedridden. She wasn't able to do any type of workouts, let alone go for a walk. So we had to start with diet and really decrease that overall histamine load, really calm those mast cells, and then start working on nervous system regulation. That's a huge component. When you're someone that is that sensitive, you have to start with the nervous system and the limbic system. That's where you need to start. And then you can start gradually bringing other things in. So diet, limbic work, really, you can even start to work on underlying drivers like gut health, gut infections, nutrient deficiencies. But usually when patients are that symptomatic, like they can't even walk, they're reacting to everything, it's very hard to give any supplements or anything with these type of people. So you have to go so slow. But going back to this patient, starting off with limbic work, I've worked with so many people like this. And so as Dr. Campbell, you start with that, really work on diet, gentle things, and then you can start incorporating things. Because when the body feels safe, this is when you can add more, right? Because the body looks at everything you put in it, on it, as like a big reaction. Like it looks at it as unsafe, even if it's something that's healthy for you. So it's very, 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 very hard to deal with, but stay the course, work on those underlying drivers, and things will start to balance out. So if the rebounding, this is going back to that question, if you're dealing with a lot of muscle pain and you're not sure where that's coming from, I would really, potentially work with a practitioner that can really help you figure out what's driving this, but also give your body time as you work on some of the gentle things like limbic work, staying away from inflammatory foods, potentially, higher histamine foods if you react to histamine foods. And then work on underlying drivers to calm those mast cells further, whether it's, gut health, hormones, nutrient deficiencies, mold. So many things can drive it and make it worse. And sometimes COVID is just the tipping on the iceberg, right? To cause these symptoms, to make our bodies just go haywire. And in your case, potentially giving you a lot of that muscle pain and things like that. So it's different for everybody. Maybe start with gentle walking right now. If you can't, if the rebounder makes you feel really bad, I understand. And I feel for you guys. So when you're really struggling with stuff like that, because you can start to feel really trapped in your body, and it's a very scary feeling. But just know that there's a lot of help out there for you. There's a lot of people that know what to do, and trust your instincts, go slow and go gentle. But if I had to give one advice, limbic work and really honing in your diet to start so that you can really make your body feel as safe as possible. Look at your environment. What are some things that could be exacerbating the mast cells? Really start looking internally, gut health, hormones, nutrients, all the things. And then, you know, it really is different for everybody. That's why it's so important, to work with people and to get to the bottom of what's continuing to drive it. But even me, like I think I did have COVID, but I didn't really have any symptoms. It was kind of wild. I just knew um, I was a little bit tired and fatigued, and I knew some family members had it and I was around them. And afterwards, the reason why I knew I had it was I was having a really hard time taking deep breaths. Like I was really like feeling claustrophobic in my body. Like I couldn't get a deep breath. And it never got to the point where like my oxygen became low, or I felt like I needed to go to the doctor to get it looked at to make sure it was anything serious. I just really focused on the things that calm the mast cells, really focused on limbic work. I did start taking Hawthorne, which was really, really good for, it helped me take that feeling away, really. It's really good for the cardiovascular system. And it really helps with those type of, symptoms. So heart palpitations, feeling like you need to take a deep breath. A lot of people with long COVID get started on that. It's a great thing. Make sure you check with your doctor, but I know that really helped me. But again, it's just one of those things, viruses are funny, and it can really exacerbate the mast cells. And so you want to do things to really calm it. Okay. One more question here. Can I do the rebounder if I'm in adrenal fatigue? So adrenal fatigue too, it's kind of a big term that's thrown around. I like to use to be in adrenal fatigue, like your adrenals need to be close to not functioning. And so adrenal dysfunction, like let's say someone is dealing with really low cortisol. So really low cortisol, their body isn't, making much. Their diurnal rhythm, like the way that our body produces cortisol is we should be making most of it in that morning. We get that really good spike, and then it comes down during the day so that we can sleep at night. Sometimes that diurnal rhythm is just a flat line, and we're just overall dealing with low cortisol. This is something that we see. So, and usually that's due to long-term stress. Certain medications and things can cause it too. There's also autoimmune conditions that can cause it, but I'll usually see, like with acute stress, we'll see really high cortisol. Chronic stress, the body's like, listen, lady, gentlemen, I am tired of producing so much cortisol. I'm just not going to listen anymore because you are demanding so much of me. And I'm just going to, kind of kick back and not really do much. And this is why you're so tired, right? Which is directly going to impact the thyroid too, because everything is connected. It's like a web, right? With our hormones. So when it comes to that, and you're trying to really rebuild the body and help your hormones again, you have to start gentle. In my opinion, rebounding is very gentle. If you wanted to do some gentle rebounding, like even if it's not a hit, anything hit, high intensity on the rebounder, it's perfect for you. I think it's one of the best things you can do. It's working on your detox pathways. If you feel good after, if there's anything that makes you tired, maybe you pushed yourself too hard. Don't do as much next time. We are never going to encourage no movement, right? One thing that I would get in check though, and it's not just, get your workouts in check. That's a number one, of course, starting gentle and implementing a little bit at a time. You want to be making your body feel as safe as possible. Your body is taxed right now if you're dealing with adrenal dysfunction, really low cortisol. And I can guarantee there's other hormones that are accompanied that are really low in conjunction with that. You want to eat for your blood sugar. You want to eat intentionally. Make sure you're eating enough. Get your protein in. You want to fuel your body and make it feel safe. You also want to get as much full spectrum light as you can during the day. Be outside as much as you can. If it's cold, bundle up, get out there. It doesn't matter if it's sunny or not. You want to get that full spectrum light. We spend so much time in our houses, especially in the winter and cold months, on computer screens, all the things. It's giving us a disservice and it's really messing with our hormones. So get outside, get as much full spectrum light as you can. If you can in the morning, that's even better for that really good circadian rhythm pattern. And for your cortisol, get outside, get really good full spectrum light exposure in the morning time and as much as you can during the day. So eat for your blood sugar, full spectrum light. Because you have so much stress in your life, I would even say get in that limbic work, meditation, whether it's mindfulness meditation, whether you get on Oura Ring app. There's so many different things out there. There's even really good Ziva meditation that we've utilized a lot throughout the years. I like quick stuff now. I'm in that phase in my life where I'm like, okay, I need very just easy, simple. So I wear the Oura Ring and I really love, really love the meditations that they have in there. And it comes, if you're already paying for your Oura Ring in the app fee every month, why not utilize and kill two birds with one stone, right? So really getting in limbic work, working on your stress, eating right, finding joy again, prioritizing sleep. That Dr. Kirk Parsley, we did that amazing episode with him. Look at his sleep guide. Sleep is crucial for you. Sleep, diet, blood sugar regulation, and limbic work is so crucial to work to really get your body more in balance. And this isn't going to take a couple months, you guys. This is going to be a consistency of doing these things for a long period of time to really start to feel the shifts. You can't just expect overnight results. I say this all the time. You can't supplement an issue that your lifestyle put you in. You really can't. And if anybody tells you that, it's not true. And I only say this because working with so many patients, you guys have taught me throughout the years so much with what works, what doesn't, what really sticks, and really going back to the basics and taking that serious is so important when it comes to your health. So really start with the basics there. And I know your question was about rebounding, but so many of us deal with this, right? I know that I was going through some adrenal dysfunction. My cortisol was really low with everything that I was going through. And this was probably, I've really changed some things that I've talked about within the past year. And and I've been working so hard on it and to really change these patterns that put me into it, right? Because no one's perfect, guys. All the things that I tell you guys to do, I'm doing too. And I'm just really starting to feel like myself. I'm starting to get back to me prior to what my lifestyle put me in. Just being honest. So I hope that you guys enjoyed this episode. We definitely are going to do more question boxes. And, if you ask a lot of questions on our posts, if it's not something that's quick to answer, but it's going to really benefit everybody too, I'll definitely make sure that I answer that here on the podcast. Beck and I are really excited for these episodes. And I hope you guys have a great rest of your day. We hope you guys enjoyed this episode. If you did, if you can pop over and leave a review, that would be awesome. You can also find us over at healthbabes.com, where you can find our courses, our latest book. We also are on Instagram at The Health Babes, at Dr. Becky Campbell, or at Dr. Krystal Hohn. I hope you guys have a great rest of your day.